Okay, so TMS stands for transcranial magnetic stimulation. It's a safe, non-invasive neuromodulation procedure that uses a magnetic field to induce depolarization in certain parts of the brain. Those parts of the brain, the cells, the neurons there are underactive, and so what TMS does is it induces neuroplastic changes in those neural circuits, and it helps with increasing neurotransmission of dopamine and serotonin. Individuals that fail to respond to traditional treatments, which includes antidepressants, medication, and therapy, they would be ideal candidates for TMS, as well as those individuals who did not tolerate the medications because of the side effects. So treatments can last anywhere from 20 to 40 minutes. Usually we recommend 5 days a week. 30 to 36 sessions is the gold standard for the entire treatment. Usually patients report improvement in symptoms within 15 to 20 treatments, although family members might report improvement in symptoms even before. So they might notice the family members are more social, less isolative, they're smiling more, interacting with the family, and just improvement in the depression. Besides improvement in depression, we do hear that it also helps with concentration, energy, motivation, and I think that's a plus, right? So a lot of cognitive positive effects are some of the feedback that we receive. So the person comes in, there'll be a chair, comfortable chair that they'll be sitting at with the machine right next to it. The machine is the TMS machine with the coil. We will ask the patient to put in some earplugs. This is so that they don't hear the loudness of the machine. The provider, usually it's a physician, measures certain measurements on the patient. Usually we measure the circumference. We also measure tragus to tragus and then nasum to the nose. Once we do that, we map a certain part of the brain that'll show us the threshold that the patient will receive the pulses. The threshold will be indicated by a reflex in the hand. Once we see that reflex in the hand, we know that that's the exact pulse that the patient will receive for treatment. After we've measured that, we will target the left dorsolateral prefrontal cortex, which is a part of the forehead, the left side, and that's where the pulses will begin. The patient will hear clicking on the machine, and they'll also feel some tapping, kind of like a woodpecker on their forehead. But they shouldn't feel any pain, just mild discomfort. There's no anesthesia, they can drive after the treatment and they can go back to work immediately. Because PTSD is highly comorbid with depression, there has been a lot of studies that indicate that we can see positive results in individuals with PTSD and major depressive disorder. This is an option if traditional medication and therapy is not working. It's relatively safe, non-invasive, very minimal to no side effects, and really there's very little contraindications to the treatment of TMS.